Hello, welcome to Hurst Review. I'm so glad you're joining me today. Hey, we're going to do an NCLEX challenge question together, okay? Matter of fact, we're going to do a couple. But before we start that, I'm going to tell you a little bit about myself. My name is Robin. I have been nursing for 29 years. I have been a part-time instructor with Hurst Review for the past 9 years. I also help out in the marketing department. I absolutely love working with nursing students. I'm super excited to get to talk to you today. Now, hop in that chat box, tell me hello, let me know where you're joining us from, okay? Now, the first thing we're going to talk about real quick is Next Gen. You know you have 5 hours to complete your test. You will have 5 hours of maximum testing time. Now, everyone will take at least 85 questions and you will have up to 150 questions, okay? So 85 to 150 questions. Let me tell you something. If you want to pass the very first time, let me tell you a little bit about Hurst. We know what you're going through. Listen, we all of us here at Hurst Review, in every department, there is a nurse working in almost every department. Wherever you are in your nursing school career, we have been right where you are, so we know what you're going through. We understand the stress. We are a company that was built by nurses for nurses. Okay, 9 out of 10 students tell us after they take Hurst Review that they would recommend us to their friends. Y'all, they have great success with Hurst and they want to share that, and we love that number. We have a 98% plus first try pass rate. And if you do everything we ask you to do, you will enter that testing center with a 98% plus first try pass rate. Isn't that great news? We have been helping nursing students just like you for over 30 years pass the very first time. Let's talk about the NCLEX test. Now, if you do not pass the very first time, your odds of passing decrease. Now, the NCSBN tells us that your odds will decrease to around 50%. I don't know about you, but you know, I never want to be put in that category. Let's pass it the very first time. Do you know the purpose of this test? You've done everything your instructors have asked you to do. You've passed nursing school, but you still have that dreaded NCLEX. Do you know why? It is a safety test, that's right, designed to protect the public from unsafe nurses. Before they just hand you a license, they need to know that you can keep yourself safe, you can keep your coworkers safe, and you can keep your clients safe before they just hand you a license. And this test is unlike your nursing school test, but Hurst Review will prepare you for that. All right, let me show you something. When you sign up for Hurst, one of the first things you will receive is the student book. The students love this, okay? It's a workbook. And the only way to get it is to sign up for a Hurst Review. We do not sell these separately. Now, you can get this book with any review. Any option of a Hurst Review that we have, you will receive this book. Once you fill that book in, it becomes your study guide, and that is what you will use to prepare for the NCLEX. It has tips and strategies and pictures and lab values. Fill in the blank. Listen, all of that is going to help you stay focused, and it's going to provide you with like the tips and strategies and all of that. Whatever your instructor is talking about at that moment in time, all of that will be included into those lectures. Well, that's going to make it easy for you to recall that content, right? To get it into your long-term memory. All right, now, we are going to practice some questions. My friend Thomas is going to put a question on the screen, and I want you to chat your answers, okay? Chat your answers, and your first question is going to be a priority question. So they are asking you, who would you go see when you come out of shift report? One thing I want you to do when you see a priority question is I want you to pick the killer answer, okay? I want you to look at all of these and say, who would be in really big trouble if I don't go see them first? Better yet, who could die, okay? All right, chat your answers. I will be right back. All right, so let's answer this question together. Y'all ready? Okay, so here we go. In what order should you, the nurse, assess assigned clients following shift report? Place them in priority order. So when you look at this question, it's asking you to place the client in the order that you would go and see them. Okay, remember, priority, who do we need to go see first? Who could die first? So let's ask ourselves. Look at option number 3. The client diagnosed with Addison's disease who is lethargic and has a blood pressure of 86/48, a pulse of 120, and respirations of 24. Listen, one big thing that we teach at Hurst is to watch for signs of shock. Look at that blood pressure. Look at that pulse. They look like shock to me, right? Yes, what happens to the blood pressure? It drops. What happens to the pulse? It increases, right? So, anytime you see a systolic blood pressure under 90, we want you to panic, okay? This client does not have enough pressure right here to perfuse the vital organs. They are showing a sign of an Addisonian crisis, but you didn't even have to know that to know that is your top priority. So option number 3 is who we're going to see first. All right, now, I know you look at option number, look at option number 1. I know that you see those words respiratory failure and they're on a ventilator and you're thinking you need to go see them first. But listen, it also tells you they are on the ventilator. Their airway is currently stable. It's protected, right? Absolutely. But they do need some close monitoring because they require frequent sedation. So that's going to be your number 2 choice. All right, look at number 4. A client diagnosed with lung cancer and iatrogenic Cushing's disease with ABGs of pH 7.35, the PaO2 88, CO2 44, and that HCO3 22. Let's look at that. These are all blood gases here. Hey, that's a normal ABG, right? It is. Now, what do you know about Cushing's? Well, that's when the client has too many steroids, right? Do you see that word iatrogenic? Do you know what that means? That means it was caused, their Cushing's was caused by some type of intervention that we did, okay? So, a treatment or an intervention. Do you think that a client on cancer would need to have they're going to be on steroids? Absolutely. So this could lead to Cushing's, all of those steroids. So this client will need to be seen third. Lastly, your second choice client, 2 days post-thyroidectomy who has a negative trousseau. That's going to be number 4 that you would go and see. After a thyroidectomy, what am I worried about? I'm worried about the calcium level, right? Why? Well, are you thinking there's a chance they could have removed some of their parathyroids? And if they did, well, what is your calcium level going to do? It's going to drop, right? At Hurst, we teach you to think muscles first, okay, with calcium. What is a trousseau? Well, that's when they pump the blood pressure cuff up and the hand starts to do what? The hand starts to tremor. Well, we have a negative trousseau. That's a good sign, right? So, no worries right here. This is a good thing. You always want to see a negative trousseau. So this is the order in which you would go and see them. Okay, now, let me just talk to you just a minute. Let's say you're taking your test tomorrow and I call you up and say, hey, can you tell me the 4 actions of glucocorticoids? Could you tell me? Do you know the 4 major actions of your glucocorticoids? Let's talk about it. Listen, this is some core information that you have to know to answer your questions, okay? I mean, you've got to know it without a doubt and without hesitation. Think about the steroids that we just talked about with this client, okay? So what are your major actions of glucocorticoids? The first thing they do is change your mood, right? They change the mood. They change the mood. They alter your defense mechanisms. They inhibit your insulin, right? And they promote the breakdown of protein and fat. Now, you will need to know those and understand why, because that way you can answer all of your questions pertaining to Cushing's, Addison's, right? You need to know the 4 actions of your glucocorticoids. Those are very important to know. All right, so number 2, select all that apply. This is how I want you to answer this question. Read each option and ask yourself, is that true or is that false? you could have up to 10 options. There's no limit on how many could be correct. It could be one or it could be all of them, okay? Also, this is an exhibit. An exhibit question, they put things up under there like chest x-ray, additional nurses' notes, labs, stuff like that, okay? Guess what? Do you think you have to open that exhibit tab right there? No, you do not. You can choose your answer and move on to the next question. They will let you. But why wouldn't you look at that exhibit and get all the information that you can about that client, right? Okay, so read number 2, select all that apply, and look at your exhibit and chat your answers. I will be right back. Okay, let's read this question together. An unresponsive 13-year-old is brought to the emergency department. Based on the nursing assessment and current lab data, which interventions would be appropriate for you, the nurse, to initiate? Select all that apply. Okay, so before we select, let's figure out what's going on in the stem of this question. When you look at the stem and that exhibit information, don't forget to look at that, you can see that the client is in DKA, right? Diabetic ketoacidosis, that's right. They're experiencing some Kussmaul respirations. So let's use our knowledge of DKA and let's see if we can answer this question. Look at option number 1, administer KXLate, true or false. What do you think about that one? That one is false. What is KXLate used for? Well, to decrease potassium. Is this client's potassium level high? Hey, it's a high normal, right? That's right. So, listen, when you're looking at that, and you know that a client that is experiencing DKA, they are going to be receiving insulin. Do you remember what that insulin is going to do to the glucose and the potassium? It is going to drive it out of the vascular space and back to the cells, right? Yes. So this insulin that we are going to give can cause serum potassium to get critically low. You don't want to give a medication that's going to make it go low as well, okay? We don't want to bottom out their potassium, so that's false. Number 2, initiate an IV of normal saline, 1,000 milliliters with regular insulin, 100 units at 10 mils per hour. True or false? This one is true. Do you see in the stem where they are experiencing polyuria? Yes. At Hurst we teach polyuria equals shock. I want to give normal saline because that's an isotonic solution. That means it's going to go into the vascular space and it's going to stay there. It's going to rehydrate that client and bring that blood pressure back up, right? Do you see those vital signs? Looks shocky to me. Also, does the client need insulin? Absolutely. The glucose is high, so they're going to need some insulin. Number 3, start oxygen at 2 liters per nasal cannula. False. Hey, the client their O2 is 96%. When do we start worrying about oxygenation? Less than 90%. That's right. There's no need to hyperoxygenate this client. Number 4, start a second IV of fluid retention. Well, what do you think? That's a good idea, don't you think? Yes. For fluid resuscitation, yes, we want to start another IV. This one is true. This client, they're in DKA, they're going to get 2 IVs, and we run that normal saline, y'all, as fast as we can, okay? The client is dehydrated right here, and they need to replenish quickly to keep them from going into shock, okay? We need to get them some fluids going for fluid resuscitation. Number 5, insert an indwelling urinary catheter. That one is going to be true as well. Don't you think you need a way to measure the client's urinary output? Yes, and a urinary, indwelling urinary catheter would do that for us, okay? With the fluid problem, INOs will always be an appropriate action. Let me ask you something. If you didn't know your content like a brand new nurse, do you think you could answer these questions? Do you? No, you could not. That's why you have got to take that core content first, and you have got to learn that core content, and then you can apply it to many different questions, many different situations. You've got to think like a brand new nurse. Think NCLEX, okay? You have got to fix the problem if you can. If they give you an option to fix the problem and you can fix the problem, that's what they want you to do, okay? They don't want you to delay care. They want you to fix the problem. Assume the worst. You have got to assume something bad is happening in every one of those test questions, and don't forget, safety, safety, safety. That's right. There will be a safety issue in every test question. It's the NCLEX, right? They want to know, can you be a safe nurse? All right. Another question. Number 3, select all that apply. Use your rules, true or false. Ask yourself, true or false, okay? And there are no limit to how many could be correct. And don't forget, on the new NGN, you will receive partial credit. So you need to make sure you understand the partial credit rule. I will be right back. Okay, guys, you're the nurse and you're caring for a client in the emergency department who presents with hematoemesis. What information is most important for the nurse, you the nurse, to obtain during the initial assessment? Select all that apply. First of all, what is hematoemesis? You need to know what they're asking you, right? So let's figure that out. What is that? That's vomiting blood, right? So if you assume the worst, what are you worried about right here? Hypovolemic shock, right? We are scared our client is going into shock. Okay, look in the stem of the question. It says initial, okay? So you're looking for assessments that would help you quickly pick up on if the client is going into shock and fix the problem if you can. Number 1, vital signs. Those are true. The vital signs would give you this information, specifically the blood pressure and the pulse. Now, someone going into shock, what does the blood pressure do? It drops. What does the pulse do? It increases, right? So definitely those vital signs. Now look at number 2, the bleeding history. True or false for your initial assessment? That's going to be false. Bleeding history, we might want to know that, but that's not going to help us for the initial assessment. Listen, that may be some good information to know. And number 3, current medications. But that's not going to help us pick up on or treat shock right now, right? So those 2 are false. Look at urinary output. That one is true. Look at level of consciousness. That one is true. These are assessments that help you pick up on and treat shock, right? The kidneys won't get good blood perfusion, right? They will not get good perfusion, so the urinary output is going to drop. Also, the brain perfusion is going to go down with shock, so their level of consciousness will decrease as well. So your correct options right here are number 1, number 4, and number 5. When they say initial, you think about the things that you can get right now that's going to help you determine if your client is going into shock or not. Hurst review options. The first one we have for you is Hurst InStream, Hurst Live, and Hurst Now and Now Plus. Hurst Now is a guided self-paced video. You would work at your own pace. You will get excellent nursing support. You get that excellent workbook, which becomes your study guide, the Hurst workbook that all students love, and you would work at your own pace. Now, Hurst InStream is a live streaming review that comes to you, and we have convenient schedules. They're like a 3-day schedule, okay? They are taught by Hurst's expert faculty. Now, with the Hurst InStream, you get a bonus. Yes, you get a 14-day pending access in your account. And once you study the way that we want you to, you could go back and access that pending access. You will have 14 days to go through and rewatch that core content as many times as you want to in that 14-day period. Now, remember that core content, that is that content that you have to know without a doubt and without hesitation. All right, Hurst Elevate. What is Hurst Elevate? Well, let me tell you all about it. This is something special that was created. Once nursing students finished their Hurst review, they didn't want to let go of Hurst. They wanted Hurst to guide them through the study of Hurst. That is how Elevate was created. Y'all, it is a companion course for RN and PN students that we call your study buddy. It dramatically decreases test anxiety. Whew, that's wonderful, right? And it improves your clinical judgment skills. It gives you 6 structured modules, 15 video lectures, some high-level quizzes, a lot of NCLEX study tips. Students that take Hurst review and then they add the Elevate component, they say that it really, really reduced their test anxiety and improved their clinical judgment. So that is just an option that we have for you to add on to your Hurst review. Now, PayPal, Google Pay, coming soon, Apple Pay. Those are just options for payment that we wanted you to be aware of. Now, NCLEX Hurst review free events. Hey, if you're not participating in all these free events, you need to. Check out hurstreview.com/free-events. You don't want to miss any of these. There's over 11 topics, many reviews, NCLEX challenge, high-level questions. 101, that is that core information every student needs to know before they go and sit for the NCLEX, okay? All right. Let's see, make sure your friends know about us. Invite your friends. Listen, you want to make sure that they can get in on all these free events. Guess what? I have a discount code for you today. Yay! Free 2025. That gets you $40 off of InStream. That gets you $25 off of Hurst Now. You can include Elevate, which is Hurst Now Plus, or the Acid Base Essentials. That is a 4-part series that will help you master acid base. Check it out, hurstreview.com. Make sure you're following Hurst Review on all social media outlets. My friend Ashley and her friend Sarah, they love to give away free stuff, but they will keep you up to date on what's going on in the Hurst world. They also have a cool podcast, so check it out. HurstReview.com, there's our home office phone number. Y'all, there is always someone here eagerly waiting to talk to you, so don't hesitate to call us. All right, that's all I have for you today. I want you to stay safe. We hope to see you again real soon. Take care. Bye for now.